What we're going to be talking about today is, obviously the title is Pump Up Your Volumes, and what we're talking about here is, looking at how we're increasing our volumes in rural health, how we're looking at, not only increasing our brand and our image and our reputation and things like that, but what we're specifically doing in order to increase our particular volumes in our facilities. So as we look at that, and Amy and I are going to co-present here, is we're really looking at three components that you're very familiar with: a strategic plan, a community health needs assessment, and a marketing plan. And one of the things that we've noticed in our work in doing this with organizations around the country is that, as an example, an organization might have a strategic plan, but they really don't use it. Or sometimes they don't, or it's not really very detailed. It doesn't have certain metrics. And as we'll talk about, in order to really do an effective marketing plan, you really have to base it on the goals that are outlined in your strategic plan. And I think sometimes the same thing can be said about a community health needs assessment. We all need to do them. We know what they are. Sometimes, not always, but we're kind of checking off the boxes like we have to do it. We got to get it done. But what we're going to talk about is, how do you really use those three tools together to really think strategically? Then again, we're going to talk about from there, a little bit more details on some of the aspects of a marketing plan, and then really get into some evaluation and some metrics as well, and how that's important for you. So,
all right. Good morning, everybody. So some of you may be familiar with this program. Just kind of wanted to get a pulse on where you're at and all of this good stuff. So we want to know where your skill sets are in measuring and approaching your strategic tactics. So we've got kind of clueless. Okay, what are you doing? I am happy to help, and I am ready for this. So how many of you are at the stage? We don't, as an organization, we need serious help. Okay, okay, I kind of get it. What are we doing? Anybody at that stage as an organization? I see a couple. I'm happy to help. How many of you are at that level? Seeing some more hands. And some are ready, just have some extra steps to take. All right, I like it. Let's move on. All right, so as Mike said, we're going to talk about the strategic plan, the marketing plan, the CHNA, and getting them off the shelf. And for some organizations, you might be missing a couple of these components. So there are some really great things that we're going to talk about today. And the first one we want to talk about is the CHNA. We all know it's done every 3 years. A lot of us just check that box, put it up on the shelf, call it good. But there are really some great things that we can do to align this with what public health is already doing. In Wisconsin, our public health department does it every 5 years. So we took it and combined with them, and now they do theirs every 3 years as well, so that we're on the same schedule, we're using each other, and getting that information done in a more complete manner. They have access to data that we might not have access to. So if your public health department is willing to do that, it will help take your CHNA to the next level for sure. And most of the time they're looking for that key partnership. So I would definitely just ask, make that ask. So we want to make sure that we're sharing the metrics and we're choosing the top 3 initiatives. One of the things that I've been seeing among my clients is they're choosing more than 3. It's hard to move a needle on 1 in 3 years, let alone 7, 8, 9. You only have to have 3. So let's try to reduce that number to 3. And if you have more that people are, oh, we have to do everything, you do not have to do everything. Choose your top 3 initiatives. We have the annual implementation plan, which is supposed to be a living document, right? We're supposed to be changing that, working on that. It can't be anecdotal. I'm starting a committee. I'm starting a group. It's okay that's a tactic, but it can't be everything. We want it to be measurable, right? It's got to be associated with a SMART goal. So we can start a support group to reduce admissions. Now I've got an outcome that aligns with that. You might have a great respiratory therapist who's just awesome. She's got her support group going, but she really needs to tie that to some outcomes within your facility. Great partner in crime, and one that you might want to put on your chin. You do not have to go about the CHNA alone. Now, some people outsource their CHNA completely, separately, and you're kind of at the table, but you're not at the table. I needed help to get this done, and there are plenty of stakeholders in your communities that want to be a part of this. And we would meet quarterly, and yes, it's another acronym within healthcare, but your CHN can be so helpful to this process and help also share the resources. And you have to do a community survey, right? And if you want a really good one, you're probably gonna have to pay for that. I could certainly do a Survey Monkey. Some people have done that. But if you work with an organization who specializes in that data, they're gonna do a really good job for you, but it costs budget money that you may not have. Your CHN can share in the wealth of that, and they get the outcomes, the metrics associated with to do their job as well. So that community of stakeholders, which you have to have for your CHNA anyway, we met quarterly, and it's really about hitting those top 3 initiatives. So you can choose your stakeholders. Typically your 3 initiatives, they've been about the same for many organizations in the country every year or every 3 years for their CHNA. But you want to align those stakeholders with those initiatives. There might be some that are indirect, obviously, but some that directly impact that. And that implementation plan, that living, breathing document that you can put out online for your stakeholders, it's easy to have it out there for everybody. It's upfront for everyone, simple, doesn't have to be 55 pages long either. And we would, just for their time, if it's, you've got the chief of police on it, because it has to do with your mental health initiatives that you're doing, or your social workers from public health. Everybody needs breakfast. It's a pretty inexpensive meal, and you can meet, we suggest the breakfast. All right, so the strategic plan and conducting that, we recommend yearly. We have some clients who aren't doing one at all. COVID came, and the strategic plan just kind of went away. So we want you to involve your board members, do a SWOT analysis. It changes every year. And you can create a dashboard of those metrics that you are hopefully, you're associating your strategic plan with those measurable outcomes that you're trying to move. And it aligns with your CHNA initiatives. And you've gotten your public impact from your survey that you're conducting, and maybe you've asked some marketing questions in your CHNA as well. If it's a survey you're already conducting, how does the public want to hear from you? That's something that we've been able to gather, super helpful for us to tie into some of our future steps that we're going to be talking about.
Good. I'll take that. Oh,
sorry. You don't need my mic.
No, perfect. So as far as the strategic plan goes, again, as I mentioned, what it comes down to for us as we're doing marketing or helping an organization do marketing is, oftentimes we'll come into an organization and they'll say, we need to build our awareness, or we need an advertising campaign, and really, we should look at marketing as a way to grow business, okay? And so that's why we kind of talk about how we're going to grow volumes. And so part of your strategic plan, of course, is depending on how you do it, if you go the pillar route or whatever you have the different aspects of that. Well, we're focused here more on the growth pillar of that, but as you know, there are lots of other areas in terms of quality and human resources and all that. Now, all of those do have, as you look at those goals in a strategic plan, there oftentimes is a marketing solution for those. So it's just, it just makes your marketing plan so much more strategic if you actually are basing it off of some clearly defined objectives. A lot of times when I see, and we're not strategic planners per se, we're more business planners, but when I look at a lot of strategic plans, to me they're a little bit pie in the sky, like, okay, that's great, but what are we actually going to do with that? How are we actually going to measure that? Okay, so when we talk about them, and I'll get into this in a little bit more detail in just a couple slides. So in a marketing plan, a lot of components here that you would probably be familiar with in terms of, just giving the background and the description and SWOT analysis, those types of things. But a couple of things I want to just kind of note here is the areas of patient satisfaction, employee satisfaction. So those are areas that, whether or not you're doing them on your own or you're having someone help you, it's really important when you're developing a marketing plan to look at all of the information, all of the data that you have. Yes, you can look at things like, market data, how much potential there is to grow in a particular area, what kind of capacity there is, all those types of things, what kind of competition. But when you look at things like patient satisfaction scores as an example, okay, well, that tells you a lot about, okay, what are the strengths or what are the weaknesses of the organization? What are some things that need to be improved? We're big believers, I'm a big believer in the fact that when you use advertising or marketing, if there's something that needs to be fixed operationally, you have to do that first. You can't expect your advertising to cover that up or to hide that or whatever. That's not going to work. What you want to be doing is promoting your strengths. So when we look at things like patient satisfaction scores, those are things that really, if they need improvement, those are actually more important to get on the right track first before you would do any kind of marketing. Employee satisfaction scores, same kind of idea there, is that we all know in rural health in particular that our employees, there are, it's a cliche, but they are our greatest assets. They are our ambassadors, really, for our organization. We can look at all the things that we're going to do as far as digital media and advertising and outdoor and everything, but our employees are the ones, who are at the soccer games, at the grocery store. They're the ones where they're being asked the questions. And so we have to make sure that not only are they armed with the right information, but they have the pride of working where they work. And so if those are things that need to be addressed, it's important to do that as well. And so where that comes into marketing as well is that sometimes maybe if those things are identified, there's a lot of different internal communication things that can happen too. And we look at marketing, it's not just advertising, it's all the different stakeholders that we're working on and the communications that we need to have there. So, okay, so in that marketing plan, and again, I could talk about this forever and I won't, I promise. But in essence, the key to a successful marketing plan is it doesn't have to be this long book either. It really just needs to have some clearly defined objectives. And those objectives can be what we kind of call communications objectives or business objectives. And they're measurable and tangible just like you would in your strategic plan. So as an example, if you have a business objective, those are going to be things like increase volumes from here to here within this certain demographic, within this certain service line by this period of time, maybe within some geography, whatever you can do to specify that as much as possible, because what that's going to do then is that's going to laser focus your marketing. You're going to say, well, should I do that outdoor? Should I do that billboard? Should I do that digital campaign? Or was it effective? That's what we hear a lot, right? Was it effective? And I always come back and say, well, what were your goals? Did you accomplish your goals or not? That's what it comes down to. So that's on the business goal. And then there are things that are kind of more communication goals. Those can be things like more process sort of things, like how many website hits did we get, or how many people had attended an event, or what kind of engagement did we get through our digital media. And those are all important metrics as well. And you kind of have to look at the two hand in hand with one another. So if I look at a marketing plan, that's kind of one of the key components of that. And the other thing I would just emphasize here is audience analysis. It's really interesting that, even if doing marketing plans like even 5-10 years ago, we had a fewer options that we do now to really target a particular audience. In particular with digital media, there used to be this concept that, if we're in a rural market, we can't do television as an example, or that digital doesn't work because we don't have enough broadband in this area. Yes, we do have broadband issues, I realize, but when you look at the data, in particular now with things that are like streaming television and things like that, there is so many ways to pinpoint and target specific audiences in a very cost-effective way. And so that's one of the things that, we're still believers in traditional media in some sense. For instance, I still think it's important, to have your local newspaper. I wouldn't advertise too much in it, but I realize why we need to have it and those types of things. But more and more, we're just seeing that you can really specifically target those audiences through some digital methods. So this is just kind of as an illustration, but when you do that marketing plan, this is kind of what we do, and I'll talk about in a second. We break these into tiers and such, but you can see here there's a list of activities and strategies and when you're going to do them and all of that sort of thing. You can develop your own system, but oftentimes when we look at a marketing plan, we think, oh, it has to be this 20-page document or whatever. Yes, you want to kind of have your strategies outlined and such, but pretty much you want to just kind of have this, narrowed down in terms of what you're doing, how you're doing it, when you're doing it. One big takeaway I would say is when I've seen successful marketing plans and I've seen unsuccessful marketing plans, it has to do with whether or not the leadership team is involved in that process. Amy's mentioned that too in terms of the strategic plan, but that your organization owns that marketing plan. So as you are looking at objectives, and we always know that we have new opportunities or things that come up that maybe are, an influential physician or something might come and say, we really need to do this. And that may or may not be true, but just like anything else, you have to go back and look at, okay, what were our objectives? Does this accomplish one of our objectives? Or do we need to change that objective? And so it keeps us focused, and it keeps us so that, like a lot of times people that are kind of more in a marketing role, they don't always have the leverage. They're kind of shooting from the hip a little bit. They have to sort of react to the, but if administration really owns that and backs that up, that's where you're going to have a more successful and strategic marketing plan. Let's get a sip of water here. Fighting off one of those Midwestern colds, almost there. So, okay, so a couple things here that I won't go through all of this, but just to sort of build upon a couple of things that I just mentioned here. So what's important is that you have your own planning process. This is what we do, but just that you have a process that you go through. You can make it as sophisticated or as simple as you want, but there's a couple key steps here that I kind of want to emphasize. So I mentioned before, in terms of what we have as a stage one, and that's really the information gathering. So I mentioned things like, looking at quality scores or employee satisfaction, those types of things. It's really getting that big picture of things, of really understanding things, not just in a vacuum, but as a whole. What is the situation? So, for instance, when we're doing that, we're looking at all that kind of data, looking at competitors, kind of getting that big picture. So then you take all that information and you sort of digest that, and you get to this next two, which is stage two, which is the thinking, the diagnosis. Okay, how are we going to look at this data? What does this mean? What are we going to do with it? Not just jumping like a lot of times where we want to jump to what we call stage four, which is let's just do some ads. Let's go back just like we are with everything else, and let's think about this. Sometimes in that thinking, you might need to do some research. Sometimes the research is something like focus groups, or sometimes it might be something like more of a quantitative study where you're doing, you need to do some kind of a perception study or things like that. I'm going to talk about service line prioritization in just a second, so we'll hold on that one. And then the treatment plan, again, is the marketing plan itself. And I kind of talked about the importance of objectives. That's kind of the most important thing. If there's anything that you want to make sure that you build a consensus on in your organization, is those objectives. Whether or not you're going to use direct mail or whatever is important, but it's less important than coming to a decision, on what you're trying to accomplish and what those metrics are. Okay, so in terms of this service line prioritization, what this comes down to is, how I was kind of mentioning, you get sort of pressure from, maybe different influential people in the organization that say, we really need to put a billboard on Highway 54, or we really need to, what have you. And what this service line prioritization does is it kind of finds that balance, I guess, between the art and the science of marketing. So in other words, what these different criteria are that we show on the screen are, how do you determine where to best invest your marketing resources, okay? And you might look at these and say, yeah, they're all important, but part of the process that we encourage you to go through is to really think these through, and we have a tool that we use where you actually weight these and all of that, but you measure your different service lines, whether or not you're promoting primary care, you have the ability, if you have different surgeries in your area or not, or maybe your goals are, whatever they might be, swing bed program, what have you. The key here is that, kind of like Amy was saying with the CHNA, you can't be everything to everyone. The philosophy, especially with limited budgets in rural health, is to do a finite amount of things and to do them very well, okay? And so when we look at this, and we have the tiering process that we go through where you determine, okay, what's gonna get the right amount of resources. But you look at things like image and market ready and immediate profitability. Oftentimes we might, for instance, be challenged with, we really need to go and market this. And then as we look at it a little bit more, we say, it's really not market ready because maybe there's a customer service issue or there's a quality issue or whatever it might be. And those things need to be fixed first, even if there is some capacity. And you can kind of see some of the other areas here. And we very well know, like for instance, downstream revenue potential. And there's always the kind of the discussion in rural health about, OB and that type of thing in terms of it being a loss leader and the different schools of thought on that. But again, that's an example where if you're looking at that from a downstream revenue or the lifetime value of a patient, you might make that argument more that it's worth marketing OB as an example. So before I hand it back over to Amy for some of the just more of the implementation of some of this, so I mentioned this tiering process, and you could do it however you want. It's just a matter of that you have a process for it. But the idea behind this is that as we looked at those different criteria that I mentioned, what that does then is that helps us to place things in these different tiers. So the idea behind it is if a service line is in what's called tier 1, that means of your limited budget, but what you have for a budget, that all of your resources, that if they're in tier 1, they occupy 60% of all of those resources. So resources certainly are money, but it can be time. You think about different special events you do, all those types of things. And then down the road, tier 2 and tier 3, again, 30% in tier 2 and 10% in tier 3. Now the idea here, you can see in this example, we have 5 things under tier 1. That's probably the most. That's probably almost too many, depending on what your budget is. So you look at things like how much money do you have, how much to invest, what's the media exposure, those types of things. To have that number in tier 1 be as few as possible. And then from there, you might have more things. You could have 10 things that are on tier 2 or 10 things that are on tier 3. And you can kind of just do the math in terms of, so where this comes into play is, we're all challenged with things. We're going to look at those criteria and say, okay, yep, maybe we've identified profitability as one of the top things and what have you, and that's going to help us make those tough decisions sometimes when we get people that are well-meaning, but let's say someone from home health comes and says, we want to do a advertising campaign for home health. We want to recognize that facility, recognize that department. Well, maybe if it has to do with equipment or something, maybe there's some profitability there. But generally, that isn't something that's necessarily going to devote a significant amount of resources in comparison to other things. But it's one of those political things too, where you want to be able to say yes, but maybe not at the same level as you would with other things. So maybe that's going to be in a tier 2 or tier 3. And what does that mean? Well, when you look at your budget, maybe it means they're going to be in a newsletter or they're going to get a news release or something like that. But if something's in a tier 1, then it obviously devotes more of a significant investment in your marketing dollars. So it just helps to really, like I say, kind of keep things focused.
All right. So we're going to communicate these results to our stakeholders within our community, within our organization. How do we do that? And who are we including all of the right stakeholders? So obviously we need to communicate to the community, and typically we publish this out on the website because we have to, and some of my clients are still missing that. So make sure that your website is in order and that it's looking good and it's easy to find. The board and hospital leadership, communicating the community health needs assessment to them. Board's got to ratify it, right? And hopefully a couple of them have been a part of the process so they can be cheerleaders when we go to get that ratified by the board. Your staff, do they even know about the community health needs assessment? And your referral sources and providers to make them aware of what's going on. So obviously, we talked about the website. If you haven't reviewed your website in a while, that should be at minimum an annual thing that you're doing, not only for publishing your community health needs assessment, but all of your service lines. You get a new orthopedic surgeon who has some new procedures that he's offering. Have we updated that information in a while? Do we have any provider videos, stuff like that? Videos in general to explain the community health needs assessment with a local partner. take it on your iPhone. The cameras are way great now. That's something you can do. Patient Family Advisory Council. If you do not have one, I'd highly recommend getting one with representatives from people in your service area, from different zip codes. They can also be cheerleaders in your community health needs assessment and strategic plan. Community ambassador. Do you have any community ambassadors who are out? I know there's a couple sitting in here that's one of your jobs, is to be a community ambassador. And then your community benefits report, we all have to do this. So we've done it differently for clients. And if we've heard in the community health needs assessment, perhaps we asked, what are you leaving town for? I may be able to purchase that through some market share data, but what's their perception? Are they even aware that you offer orthopedics or dermatology? Those are questions you can ask in your community health needs assessment, and sometimes we forget. We make it all about health, 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 but there's certainly some things that we want to get perception-wise from our community. And we can share those results through our community benefits report. And however you do that, through your waiting area posters, or if you've got the big display screens in your waiting areas, obviously website, I'm going to hammer that all day long. Patient portal, you can talk to your super users on your patient portal and what's that home facing page look like? Is there something we can communicate there? Are we doing screenings through our patient portal that tie directly to the top 3 initiatives? Most EHRs have those screenings available for your patients. Optimizing that EHR for that patient portal can be done. Sometimes it means an invitation of the marketing department or someone who's aligned with your marketing efforts to be at the table. One of our clients that we did this for, we actually, Spooner Health, we communicated some key results in their community publication. And this is something that they also put up within their facility, their PFAC, Patient and Family Advisory Council. They got a copy of it, the board got a copy of it. These are key metrics that we wanted to move, and we made it in a really great infographic, in my opinion. And this is something that you can easily do to help transfer that information, put it out on the website, all those things that we talked about before. Having a board member and a senior leader team member be a part of your CHN, that community health improvement network that I talked about, just getting all of those right stakeholders at the table to be your cheerleaders for this. As the rep, they can communicate wherever they're at, in your community, at board meetings. We also want to encourage people to follow us on social media. We actually had an employee campaign where we asked them to go like our social media. Again, it's just taking the time to make the ask. We made it a part of our orientation program where they would go in and like us right during their orientation program, because that was yet another way for them to be a cheerleader or an ambassador for our organization. And then highlighting board members and senior leader team members in your social media. Welcoming new board members, welcoming new senior leader teams to this organic posts, and the more familiar faces they see, they play really, really well on social media. If there isn't someone at your organization who's responsible for that, make that a priority. Communicating to staff. We started a weekly update. We used MailChimp. You can use Constant Contact. We were putting out like a 7-page PDF every single week to our employees. You're never going to believe it. They didn't read it. Weird. We couldn't tell who was reading it, and you'd hear in the hallways, well, I didn't know that. Well, I didn't know that. So we started MailChimp, totally free. We worked with HR, got an employee list together, and each week, 3 key bullets. That was it. And so when the Community Health Needs Assessment Survey came out, we shared the link with them to share with their families. We gave a $10 gas card for anyone who completed the Community Health Needs Assessment. We actually had to limit it to the first 500 community members, and we said staff couldn't earn that. That was a great incentive. And to have over 500 people in your community give you that free feedback, super great. Yes, you have to budget. You might be able to work with a local gas station company to donate those gas cards. We were fortunate to have that partnership. I'd highly recommend an incentive. An intranet page. If you do not have an intranet page for this Community Health Needs Assessment or a marketing metrics page, something like that, get that started so that we can also share that link where we don't have to share so much information in the weekly update. They can go find it on the intranet when they're bored and have nothing to do. Share the county health rankings. A lot of people aren't familiar with the county health rankings. Compare it to your key counties that you're with, that are around you, so they can see where you're performing. More information is good information. Obviously, employee forums and town halls, whether that, bring those back. I know COVID, it was one of the casualties of COVID. Bring those back and have a way to communicate up and down. And then an employee ambassador program. We have a really great document that outlines exactly how to start an employee ambassador program, how to lay out what should be the content of that, who should be representing the hospital in that employee ambassador program. There's lots of ways to communicate with staff, and it's just having someone who's that gatekeeper, the owner of that. Communication is key, and if you don't have anyone owning that process within your facility, it's gonna be really hard to raise volumes, to have people aware of what you're even doing without somebody who truly owns that process and having some key metrics tied to that. And then communicating to referral sources. We started a monthly stoplight report. So red, yellow, green. Green, these are the things that we're working on right now that are almost done. Yellow, these are the things that we're at the beginning stages of, we're exploring. Red, these are the things that you've asked for, but we cannot do them. It was a very short bulleted list for our providers to know what was going on. We'd drop it in mailboxes, we'd email it, so that we'd throw it out on tables at med exec meetings, at those med staff meetings, so that they had just one more form of communication. We started a provider hotline. It was a 4-digit extension that they could call any time of day, leave a message on something that was really aggravating them or something that really liked. I'll tell you, most of the time it's aggravating. That was our conduit to be able to fill that monthly stoplight report with our to-dos for providers. It's a great tool for re-recruitment of your current providers. It was a simple PDF that we put out once a month that really gave them a pulse to, we've heard you, and this is what we're doing about it. And then ensuring your workflows and your EHR. Get marketing to that EHR table. I was not first at that table, and once I became a clinic director, I learned so much about what the EHR could do, but we didn't have a super user connected to some of those patient experience improvement methods. So getting somebody to that table to help with patient experience and we worked on the referral management module within our EHR. We didn't have anyone at that table before. So just having somebody who could have the capacity to even look at that and work on that with your providers, because we were using sheets of paper that we walked around the hospital for referrals. It can get better than that through your EHR, I promise. And then the last step is your evaluation of all of those methods that you've done, right? So through my MailChimp, I could see how many employees were engaging with us each week. Who was reading it, who wasn't. I could pick out my employee ambassadors from that. I know that this person is highly engaged. They literally go into that weekly update and click. Through my clicks, I'd hide prizes in the weekly update. Here's a $25 Amazon card, and hide the link in there. You can find out who your engaged employees are there. Obviously, you have to evaluate your CHNA efforts every 3 years to see where you've been and where you're going. County health rankings, did we move the needle on any of those? We went from 6 mental health days to 3 mental health days in 3 years because of the tactics that we did, which was starting our patient-centered medical home clinic. We grew our own licensed clinical social workers because we couldn't find them. So there are just those. It's a great way to look back and reflect, is what we're doing working? Your strategic plan evaluation is in your KPIs. And I still find that a lot of my organizations are missing tangible KPIs in their strategic plan. It's so important. And if you don't have a dashboard of those metrics available for your team, how are you going to move those needles without them knowing what those needles are? Satisfaction, we want to maintain that or increase that with your employees. If you're not conducting an employee engagement survey, please do so. It's going to be honest. Some of it's going to hurt, especially post-COVID, but there's really great action items that you can get out of that, and that's how we get better. How often do you do those? Some of organizations are doing it every single year. Some haven't done it since before COVID. Some don't want to know at all, so they just don't do them. At least every 2 years. At least every 2 years. Your marketing plan, that's every year. I can get my patient volumes. If marketing doesn't have access to those metrics, get them on a committee where they can get access to those metrics. I cannot tell you how many people do not have access to patient volume data. It's mind-blowing. It's in the EHR. It's a report that can be automated, and getting marketing to that table is really, really important. Out-migration should decrease if we're doing this correctly, right? So we heard in our community health needs assessment that they wanted dental care. How are we gonna move that needle? Chiropractic care, orthopedic care. We know that they're leaving town for allergy care. So hopefully we are bringing in service lines that our community has a perception that we don't have, or we beef up our marketing to make sure that we're communicating that they do have it. So you should see out-migration decrease with that. And obviously the inverse of that is your volumes increasing. So hopefully today, I hope that you got that marketing should be at these tables. If they're not, please invite them. It will help. These three components they're a quilt. They should all be put together. They're not just made to be put up on a shelf and not looked at. They need to integrate together. And communicating those results, there's tons of great free budget-friendly items. CFOs are happy about that. They're not supposed to collect dust. Communicate, communicate, communicate. And then obviously evaluation, getting IT to the table to help you come up with those metrics and making sure that we've got the processes in place, like Mike was talking about. If your prior authorization process sucks and your patient signs up, they've got their MRI all set, and 3 days later we call them to tell them, yeah, we didn't get to the prior auth process, we're gonna have to delay that. It happened in my facility all the time. So unless those processes are fixed, it's putting lipstick on a pig, right? All right, so that is all I have.